Hello, everyone. My name is Maria Elaine Fontanilla, and I am here to talk about vulnerability and vulnerable populations. So, the first thing is, what is vulnerability? According to our textbook, vulnerability is a susceptibility to actual or potential stressors that may lead to an adverse effect. And what are those vulnerable populations? So if you look at the left here, the first box, um, vulnerable populations are people who are poor and homeless, pregnant adolescent, migrant workers and immigrants, severely mentally ill individuals, substance abusers, abused individuals, and victims of violence, persons with communicable disease and those at risk, and persons who are HIV positive, Hep B or STD. And on the right here, we'll talk about the factors that contribute to vulnerability. These are poverty, human capital, and disenfranchisement. Let's talk about poverty here for a second. So, in our vulnerable populations, um, they have they have a limited social support. Um, a lot of them probably work in hazardous environmental resources, such as the immigrants. For example, they work in an environment that are probably working long hours. Of course, they are far away from their clinics and also hospitals. So therefore, they probably don't get physical screening in a regularly, and of course, they are very prone to uh, working in hazardous environmental places because they're very exposed to pesticides. Disenfranchisement. This refers to the feeling of separation from mainstream society. Let's give an example. Let's say the immigrants. They are separated from, of course, the cities, right? Because they are working pretty much in very rural areas. And let's talk about the substance abusers, of course, and also the homeless. They have a feeling of being separated from the mainstream society because they are living in a different lives than we do. And the next one is the human capital, refers to all of the strengths, knowledge, and skills that enable a person to live a productive and happy life. So let's talk about this for a second. Um, a lot of the vulnerable populations, the one that we mentioned earlier, the immigrants, the substance abusers, mentally ill individuals, do you think they have a strength and knowledge to live a happy and productive life? Or do you think they will need help? Of course, all of them will need help. For example, I volunteer in a homeless shelter this semester, and they have a lot of programs that would help them be more independent, actually. They will help them write their resumes, they will provide them skills that would help them get jobs in the future. So therefore, they will not just be staying in the homeless shelter um, chronically. And most importantly, they don't have to go back to being homeless. Okay, let's go back up a little bit here. So a lot of our vulnerable populations, the outcome will not be very good for them. For example, since they don't see the clinics or doctors very often. They're very prone to having chronic illnesses, um, and they will also feel a lot of them also feel depressed and isolated from our society. We learned in this class that people who are substance abusers, for example, we have to put them back in the society because it's in our human nature to be connected to people. So therefore, if they're not connected to us, because of maybe they're feeling ashamed or um, embarrassed of their past, they will feel isolated. They will constantly having a hard time trying to go back to society, and of course, the stigma doesn't help them either. And because of vulnerable population, um, not regularly go to the doctor and be seen, they have a higher mortality uh, rate than the general population. Also, because of the poor diet as well. For example, homeless people, even though they have soup kitchens out there, if they have, let's say, a hypertension, they don't really think about too much of how can they eat healthy. They just think about, oh, I'm going to eat today, right? They don't really think about too much of maybe I should cut down my sodium. It's pretty difficult for them. And of course, the migrant workers, because because they are separated from the society a lot, they have a barriers to healthcare. And of course, patients who or people who are having HIV or they're very prone to infectious disease, right? Not only they're feeling separated from the society, but also they're very prone to infectious disease because of um, the virus that they have. And as nurses, our nursing intervention for the vulnerable population is to increase the resources or to reduce health risk in order to reduce health disparities between vulnerable populations and non-vulnerable population. And how do we do this? We want to provide education to these individuals. For example, again, in the homeless shelter that I'm volunteering at, we provide education not just to their health, but also where can they go, where are these clinics that they can go to in order to get screened in a regular basis. For example, also when they run out of medications, where they can go, which clinic, who are the doctors they can go to, and um, if they don't have insurance, they can sign up for medical, and we also teach them how can they sign up for medical if they don't know how to. And that would be all. All together, the vulnerable populations are very prone also to chronic illnesses, such as any kind of chronic illnesses, because they don't get, like I said, they don't get a checkup regularly. So they're probably not even aware that they have it. Vulnerable populations will definitely need um, a lot of support, not just from nurses, but also from the society as well. And so that would be all. Thank you so much for listening to me, and I can't wait to watch or the rest of everybody's videos and presentation. Thank you. Have a good night.